Well, hello. Just want to introduce myself. My name is Dr. Ben. I'm a clinical psychologist. I currently work as a psychologist in a prison. I have between 20 to 25 patients that I work with on a regular basis, all of which have serious mental illness. My past job, I was a chemical dependency counselor. I used to do sales, and I'm also retired from the Army. I have a extreme passion for doing mental health, so I wanted to create a video and introduce myself. But I wanted to create a video because I think there's a lot of frustrations with the mental health system, and how could you navigate it? How could you find what you're looking for? So first, let's talk about who to go to. Okay, it depends on what your needs are. The challenge is, like, let's say you go to your general practitioner and you tell them you're depressed or you have anxiety or you feel a certain way. I have a particular pet peeve on medical doctors or general practitioners creating a mental health diagnosis without doing a full intake, without doing a full background, and without really knowing who you are. A couple things about having challenges, mental illness versus just an everyday life experience, right? Because sometimes you'll hear people say that they're depressed or they have anxiety or they have different things going on. Sometimes those are just human experiences. Those aren't mental illnesses. And yes, you go into therapy or having counseling to work through it. Like, let's say somebody's feeling their mood is low, and the reason why their mood is low, they took a loss. They took a tragedy in their life. Well, that's a natural response. That's not a mental illness. Or feeling anxious. Reality is if we didn't feel a little bit of anxiety, we wouldn't get out of bed. So it depends on what level of that anxiety or how high the level of anxiety is before it becomes an actual mental illness. So what I would recommend for you, if you're looking to work through a particular mental health issue, is go to people who are trained to do this. So some of the examples are licensed clinical social workers, counselors. You can also go to free support groups, or you can talk to somebody like me, who's a psychologist, a therapist, things like that. We're specifically trained in the concepts of mental health. Folks that are not trained in the concepts of mental health is your fucking family or your friends. And my guess is some of the challenges that you have, they might have started it. So just be cautious about getting mental health advice from somebody who's not qualified to give you that advice. People might be well-meaning, but their information is bullshit. So if you're trying to get like popular psychology, where there's a 20-second video on how to make your life all better, yeah, good luck with that. I hope it works out for you. But that's not how mental health works. That's not how coming to terms with yourself works. Okay, it takes time, and it takes you being honest with you. So one thing that I hear in therapy, or complaints about other therapists, is, well, this therapist didn't tell me what to do. They didn't give me the guidance I was looking for, things like that. So there is different philosophies in therapy, different modalities, different types of training that goes along with becoming a therapist, right? But one thing that we're not is a life coach. So if you're looking for a person to tell you what to do, what you want is a life coach. You don't want therapy. My job specifically is to sift through possible areas that you could do, but you have to come to terms with, do you want to do them? So walking through your past, or walking through your relationships, or things like that. If I am going to do my job, I need to know who you are and how you react in the world. And that takes time. So one of the things that I'm warning you is when you go to a medical doctor or you go to a clinic or you go to a particular place, and after 10 or 15 minutes, that particular doctor gives you a mental health diagnosis, I'll be highly cautious with that. I'm going to tell you what, generally speaking, a good intake should take, I don't know, probably about 3 hours, going through your full history, going through all of your past, and going through treatment goals. What is it that you want to accomplish? So if you step into an office, you talk to a doctor, 50 minutes later, you're diagnosed with something. Well, unless you're doing some intensive follow-up, I don't know how that diagnosis could be correct. And for me, when I work with somebody, so I'll get somebody on my caseload, and everybody on my caseload is required to have a serious mental illness. So regardless of what the diagnosis is, I follow that person's behavior, and I look at that behavior over a period of time. So even if I think a diagnosis is correct, and I'm going to initially give somebody a diagnosis, I'm still going to take 90 days to change that diagnosis from provisional to an actual locked-in diagnosis. So the reason why I'm saying that is sometimes people are so quick, they want answers and they want things changed, but that's not how mental health works. Okay, so and I was thinking about the process in my own process. there was a particular time prior to me being a clinical psychologist, where I went to my own treatment, talked to the doctors that were there. One of the frustrations that I had is this one particular doctor, who's a psychiatrist, kept telling me how good my insurance was. So it sounded to me like he wasn't diagnosing me, he was diagnosing my insurance, which was frustrating as hell. Then some time passed, and I felt what I thought was depression. So I went to my general practitioner and I asked, I said, hey, I think I'm dealing with depression. And the doctor's response was, well, you would know. I said, no, you're fucking fired. Here's the thing. We wouldn't allow that for any other profession. If your car is busted and you go to the mechanic and you say, hey, it's not working, and your mechanic says, well, you should know how to fix it, you fucking fire them. You don't play games with this person. You get rid of them. Okay. So don't play games with your mental health either. It's their job. That's the reason why doctors go to school for freaking 7-10 years to do what they do. It's their job to diagnose, which requires a thorough intake. So I just wanted to put that information out there, and I want to make sure I'm not missing anything. Oh, pet peeves. One thing I did want to mention was my professional pet peeves with the medical community and the mental health community. So I don't believe that medical doctors should be giving mental health diagnosis without a consultation with a mental health professional, period. Because the other way around doesn't work either. If you came to me as a psychologist and I said, well, you have diabetes, what would end up happening is the medical board would come down on me and say, sanction me or tell me I can't be doing that. But for some reason, the medical field feels it's okay to diagnose with mental health or give a mental health diagnosis without a consultation. So I have problems with that. I don't think it's the best way to serve the people that need help. So I'm going to do topics like this from time to time. I just wanted to start first. I've never done a live stream before, so I wanted to get used to this format and see how it works. So if there's any comments for somebody that watches the video at a later date, please. I'm very interested to know what you think. And they ask you to subscribe, so please subscribe if you want to hear some more content. The next topic I think I'm going to be doing is probably on healthy relationships and the topics that lead to healthy relationships. So thank you for your time. I appreciate you letting me into your world for just a moment. I hope that you find whatever help that it is that you need. You're more than welcome to reach out to me. You can go to my website, follow my channel, send me a message if you got any questions. I'd be happy to do that. I'm doing all of these things as free resources. I have no intent of doing therapy on YouTube or any of that, but I will answer questions as I can. All right. Only the best to you and your family. I hope you have a great day. Enjoy.